This is the state of the nation. Irifa Mwanga. We are deliberate, we are reasonable, we are uncensored. The state of the nation with Henry Ssali. Good morning, good evening, good afternoon. Depending on where you're joining us from, my name is Henry Ssali, and I am privileged to serve you here as we engage in discussions, topical discussions in Uganda. A lot is happening in the country today. We lost children, and we want to send our sincere condolences to all the parents who have lost their beloved children in the last week. It's been hectic. It's been an uneasy week based on the losses we have had, but we have also lost one of Uganda's senior political citizens. He was a politician, he was a leader, and at some point he was also a liberation fighter. I hope you guys are hearing me well. If you do, I encourage you to share this with your colleagues and to invite as many people as possible to engage in this very important conversation. So today we are going to talk about medical interns. This is the second time that we are coming back in about a month. And we are returning because essentially the government hasn't thought about compensating medical interns. So we want to interrogate this further to learn what has happened in the last couple of days, weeks, and to try and figure out where we go from here. Where do we go from here as citizens who engage on a regular basis, but also as people who have relatives who serve both as medical interns, but also as patients, clients to these hospitals that use medical interns on a regular basis, because we know hospitals in Uganda cannot survive without the labor, the free labor of medical interns. So we want to interrogate that question and find out if their labor is for national service or whether it is exploitation. This case does patriotism. And these are important questions because they matter. They matter because they touch on everyday people. They touch on an average Joe Ugandan. Average Joe. Average Joe is a concept that was coined by US politicians when someone called Joe asked a very basic question in the US politics, in one of US politics campaigns, political campaigns that captured the limelight of the day. Anyway, once again, welcome to the State of the Nation. Today, we begin with a very simple question, one that hides a profound moral dilemma. Can a healthcare system call itself compassionate if it survives by asking its youngest doctors to work without pay? Every morning, thousands of patients enter Uganda's hospitals hoping to find healing. Every morning, medical interns enter those same hospitals carrying responsibility far beyond their years. They clerk patients, they assist in surgeries, They manage emergencies. They deliver babies. They also make decisions that can mean the difference between life and death. Yet many of these young doctors do this while struggling to meet their own basic needs. Of course, we celebrate them. But can a nation truly honor those who serve life, those who save lives while refusing to pay them? Today's discussion is not merely about salaries, but it's about ethics, justice, public policy, and human dignity. It is also to interrogate whether the kind of healthcare system Uganda is building is what Ugandan citizens have envisioned for a very long time. In studio with me are two comrades that we often engage with on a regular basis, Dr. Stella Nyanzi and Dr. Mirembe Joel. We have had these conversations with them before. Dr. Mirembe is here. Dr. Stella is here. Honorable Ssemujju Nganda was supposed to be with us today. I've just been informed that he won't be able to join us. But he promises to come back next Sunday. So I'm excited to have Dr. Stella Nyanzi and, of course, Dr. Mirembe, who has been very fundamental in one of these conversations. I'm going to let these two introduce themselves, starting with Dr. Mirembe. I'm going to start with Mel. Dr. Mirembe, nice to see you. Thank you for joining us. How are you doing today?
I am very good. Thank you very much for organizing this and offering a platform to this particular issue, despite the fact that those we are speaking to seem to deliberately close or cordon off their ears. My name is Dr. Mirembe Joel. Like you've introduced me to our viewers, I am one of the crusaders for this campaign. But of course, I've been a leader in this same area for some good time, where I've served as Secretary General. So I want to thank my senior Dr. Stella Nyanzi, first for always being there to speak up for the oppressed, to speak up for matters that concern the wananchi, the common man. That is not easy, especially the current environment is very, very hard and toxic, and it doesn't provide any chance for you to really do the right thing. So for those of people like Dr. Stella Nyanzi who choose to do the right thing even amidst all this, we celebrate you, we celebrate them, and of course you, Henry Ssali, my senior as well, for always creating the platform to disseminate the message, to hear from the people, and then carry the voice to those who are supposed to act. Thank you very much. I wish a good platform, and I want to request those who are watching to share the message and share it until when it reaches wherever it's supposed to reach. Thank you very much.
Thank you so much, Dr. Mirembe, for sharing your thoughts and for saying hello to the audience, our audience that listens to us on a regular basis. Dr. Stella, nice to see you once again. How is your Sunday? There's a lot that is going on in the country. Of course, I mentioned about the children that passed on and also the senior comrade that passed on. How are you doing today? And could you say hello to the audience?
Hi, Henry. Thank you for organizing this space. My Sunday is as usual. These days I look forward to meeting you every evening to talk about what's happening in Uganda. And I want to thank you for bringing me along with Dr. Joel Mirembe. Dr. Mirembe, how are you? Thanks for the greetings. And I think what he says is important about speaking out. I particularly celebrate comrades who are still in Uganda and still talking about the governance failures in the country, because we know it's very risky. We see growing repression, but I think that is why it is really important for those of us who are outside the country and have the ability to speak from wherever we are, to keep on amplifying the issues that are back home. I know that people say to me, Stella, you live under the illusion of being safe because you're in exile. And I say to them, the comrade who died, Moyoga Gwanga, that amazing police officer, reminded us that Boyogerofa, Bosirikofa, no Recho Yogera, Echijachije, which translates as if you speak, you die. If you keep quiet, you die. So you may as well speak now, such that when you die, you will have spoken what has to be said. And I think for me that in terms of the topic for today, the medical interns topic, it's an important topic. One can speak in terms of the governance failures. Those of us who are government critiques are able to do that. However, this is a human issue that affects all of us, whether one is NRM or in love with Yoweri Museveni's dictatorship or not. We all will have health challenges that will take us to a public health facility at some time. If one is wealthy enough and they can afford access to private health care, or they have health insurance, or they can be taken abroad, it doesn't mean that their family members who are in villages are not going to need access to public health facilities. And maybe the most important for me is, even when I had access to a medical doctor as a father, there's a time I was involved in an accident in Natete, and I was not taken anywhere else. I was taken to Mulago. And so having the protection of having access to a medical medical services in a private clinic with all my family members, the majority being healthcare workers working in private healthcare, I ended up in emergency at Bulago Hospital. And the people who attended to me before my father was called were medical interns. And so this for me is a topic that really is about all Ugandans. And so I celebrate Dr. Mirembe and other comrades who are offering leadership in terms of being at the forefront in Uganda, raising this issue, amplifying it. And I think my duty is to join you and others, Henry, who are abroad, who can amplify. So I look forward to the discussion this evening. In terms of the people who have died, in addition to General Moses Ali and the children from King David Junior School, I also want to commiserate with Bishop Christopher Ssenyonjo, who died today in hospital. And may God grant their families comfort during this time of loss. So I look forward to our discussion. And I look forward as well to Honorable Ssemujju Nganda. I was so excited when I saw the advertisement. It's a pity he's not here, but Comrade Ssemujju Nganda, wherever you are, we look forward to engaging with you in future. Thanks, Henry.
Thank you so much, Dr. Stella. Ssemujju will join us as soon as he's able to. He just couldn't due to conflicting scheduling today. But I'm going to start with Dr. Mirembe. Dr. Mirembe. So I hope this question is not as uncomfortable as I think it is, and I hope you're able to answer it. I know you've been answering very uncomfortable questions in the past, and I know you're not someone to shy away from these uncomfortable questions. But if a hospital cannot function without unpaid medical interns, is it just underfunded or fundamentally dependent on exploitation?
Yeah, thank you very much. Before I answer that question, allow me also pass on my condolences to the families of the young people who unfortunately lost their lives and around Kapchora in a bus crash. It's a message that sent a lot of shock waves, especially us who are parents and have these vulnerable, very young children. A lot of things were like came in my mind, and I'm like, what? So the parents, the friends of the children, the relatives, we stand with you during this very, very tough time. And we pray that the Lord will comfort you, take you through, and you desire and the government should put in place some mechanism of psychologists, psychiatrists to keep monitoring these people and make sure that we don't get actually more mortalities from the people who are still alive because of the traumatic, psychological traumatic events that are right now running their lives because their families which lost 2, which lost 3. Yeah. So now going to your question. One, I will start with an example. The Honorable Chris Balyomunsi, a medical doctor by training, a Minister of Health, rushed into Mbara Regional Referral after hearing a patient cry out that they were mismanaged in the night. And he said he didn't find staff. He said he found a lot of patient congestion. He also said verbatim that patients didn't have drugs. But whatever he said was not new. And if you did an audit and investigation, it has nothing to do with the director of the hospital. It has nothing to do with the staff. At least I trained from Barra Uniform when I was doing medicine and surgery for 3 years before I even became an intern. So I know how that hospital runs. Then the health monitoring unit, Dr. Namara came out the following day and displayed the financing of the hospital. The staffing levels are at 26 Ssali. That means where you need 10 doctors, you have there 2, maximum 3. So those are the 3 who are supposed to divide themselves to do all the work that's meant to be done by other 7 doctors at the basic minimum. So one, Uganda as a country, why the hospitals can't run with medical interns? For clarity, medical interns are trained, skilled people. They do surgeries, they treat with medicine, all manner of things other doctors do. And personally, as a medical intern, I did 50 surgeries on mothers delivering babies. And that's just an example. There are very many other surgeries that I did. But because that is a common procedure, so it's easy to use to discuss on a public panel. So one, medical internship is part of our professional growth, career growth. Internationally, it's not only in Uganda or Kenya. That's why you find in places in Kenya, an intern doctor actually earns more money than actually an associate consultant in Uganda. Because associate consultants here are paid around a gross of around 6 million and 6.2 million. Okay? An intern doctor in Kenya, when you convert the money they get, they're around 7.5 million. Associate consultant is a doctor with a master's degree. A doctor who has a master's degree, and he has also practiced for a minimum of 3 years as a specialist. You get it? So internship is part of professional career growth upwards. After you have graduated, it is professional international standard, World Medical Association. You cannot just change the medical system. So you are recommended and you are requested to work with Ssali. If you are a journalist, you work with Ssali who has been hosting the State of the Nation address for the last 5 years plus, such that you get more, when you are setting up StreamYard and things are not probably working, Ssali's clause here, you can tell you, oh, actually, yes, the protocol says this, but actually, according to the practices of how I've been doing, you can do this and it works for at least a year. Because I think the spirit behind that is that, you know, life is not like when the engineer does a bad pothole, the road can get does a road and the road gets potholes very fast. They can be seen and fixed before even it causes an accident. But when you ever make a mistake on life, most of the time it is lost. And there is no chance to return back that life. So the issue is medical interns, Ugandan hospitals can't function without the medical interns. One, because government doesn't put healthcare as a priority. Dr. Namara told us, Mbara Regional Referral requested for 53 billion. And they gave them 3.5 billion. You request for 353. They give you 3. And they want you to provide state-of-the-art care. You get it? Mbara Regional Referral Hospital was designed to offer service to 500,000 people. It is offering care to over now 10 million people, almost. You get it? Around 7 to 10 million people are seeking care from that hospital. Majority of the advanced services it's giving, it's donor funded. Those specialized clinics, the innovations are all because those doctors that government is castigating, sit down, write grants, and those grants bring money into the hospital. Then the hospital can offer free services to those vulnerable women. The cancer center there. All of those things are donor funded, but not because actually government did something, because those few 2 to 3 doctors deployed out of 10 treat the patients, get tired, also get their weekends and write grants that bring in money. So the issue of the intern doctor in Uganda, it's not just even career. The government hospitals need the interns because they are the ones who do most of the work. And of course, they are supported by the seniors. But without them, the common Ugandan will suffer. When they are not facilitated, the common Ugandan as well will suffer. Why? Someone who is psychologically not stable will not provide quality service to anyone. And that's why I usually call on the common people to interest themselves in this conversation. Why? The ministers, yes, they will come for emergency care at those facilities. Like someone said, Fate is a double crosser. They will come for the emergency services. But after the emergency care, they will rush. They will be rushed to Kenya, Nairobi, where intern doctors will work on them, paid intern doctors will work on them, and everyone else. Intern doctors should not be despised into anything. Personally, whenever my parents get sick, my own children, my wife, in fact, we have delivered Henry 3 children now with my wife, and all of them we have delivered them in a government hospital. And it has worked on us. Okay? You get it? So it's not, and you know, for me, I'm a doctor. I'm also a lead of doctors, you know? So, but the entire team, the team works together. Where the intern doctor is supposed to work, the intern doctor will work on you. Because he's a trained profession. He has a provisional license from the medical council. So the issue is priority. Funding is not there. Then there is a part that has promoted bad apples from being many. That is supervision. The people who are supposed to supervise don't do the supervision. And those are the politicians. Those are the people at Ministry of Health. And I will end with this current, I call it a stunt. I call it a campaign program by the regime to parade vulnerable health workers in 2 cameras, question them in 2 cameras. That would have been good if it is being done in good faith. But it's not. It's just a stunt to make the regime look very good, the regime look very caring. Yet actually, in actual sense, the Uganda Medical Association, where I have been a member, where I have been a leader since medical school, has candidly in a very organized way, spoken and addressed the state about these issues. Poor medication not being enough, poor staffing gaps, very congested facilities that need expansion and renovation, lack of housing for staff. You see someone comes in that and says staff are not here, but these people don't have housing near the facility. You know, the houses that are there were built over 50 years ago. And because the patient numbers have increased, there is some been increase on the number of staff, though poorly, not adequate according to the numbers being served. So these people are staying in their homes, and when there are emergencies, probably ambulances are supposed to pick them. Are the ambulances even there? And what made me very happy is that the Honorable Chris Balyomus found the intern doctors on duty working. Those people who were found working in the middle of the night when he went there, they don't want to pay them. They want to give them food. These are parents. Medical school is very long. These are parents. And for some of us from very poor, or what the Muzungu usually call the humble background, whenever you finish, you go to medical school, everyone's attention is on you. They expect you to be the hope. So now someone wants you to again work for free for another year. Then there are those people who were probably nurses and clinical officers. Then they admired being a doctor and they went back to school. So government in particular, those ones, even currently, it has not paid them for the last actually 6 months. Actually, they are accusing them that probably they were employed somewhere else. But remember, the intern works 24 hours, so they can't even go back to work in their nursing status such that they can get some earning. So this government has money, but what it doesn't have are the right priorities. It has priorities in luxurious expenditures, priorities in being exploited by investors, priorities in politicking. You have very many RD. Now the office of RDC, I think now has 4 RDCs, because there is RDC, deputy RDC, and 2 assistant RDCs. And they have proposed they are going to pay them over 12 million, I think, each. So you're going to pay a senior 6 dropout 12 million, but you don't want to pay a doctor where a parent or government has invested over 100 million. To graduate from medical school, the minimum investment is around 100 million. You don't want that. You are telling people to do sciences, but then they have done the sciences, and you are telling them to work for free. After working for free, they will stay unemployed on the streets. Then Uganda is on the red list of the World Health Organization. That means Ugandan doctors cannot easily migrate in mass numbers to work in other places where they are needed, because the doctor-patient ratio in the government structures and records is very low. So what does this government, what do the common people want us to do? Thank you. I think I can stop at that for now.
Yeah, for now, I think these are very important questions that you propose as well. So what we can confirm from what you have said is that medical interns are not just observers, right? They are essential frontline workers. This is what they actually do. They do a lot of work in hospitals. They deliver babies. They take care of the sick. But they also do a lot of other work that may not be done by senior doctors, because they are available, they are young, they're enthusiastic, and they are looking for experience. Dr. Stella, medicine is not built upon compassion, but compassion is not something that doctors can give to patients. Based on what Dr. Mirembe has said, should institutions themselves be compassionate towards those who provide care? And do you think compassion can exist where exploitation exists as well? Can these two coexist, compassion and exploitation?
So I think for me that when you began your question to me, you said doctors are not compassionate towards patients. Now, I think as a patient that many times I was raised to think that doctors are very compassionate. That is why they do the job that they do. I think that in terms of the service they offer, particularly because they're working with sick bodies, ill bodies, contaminated bodies, contagious bodies. In the case of Uganda, we've had our own share of epidemics, Ebola, these very contagious, scary infections that many times to work as a medical doctor, one is actually propelled by compassion.
It is indeed.
And
I mean, I might have spoken, but yeah, I meant that medicine is built on compassion itself.
right.
Right? You
Okay.
cannot
So
be a doctor when you're not compassionate
very
about
good.
what you do, but also about the people that you're taking care of. I think compassion is a very big component of someone's becoming a successful doctor. The question is whether the government is being compassionate to doctors, to intern doctors before
Right.
they become senior doctors. Yeah.
So I think it's good that you've clarified that, because I think for me that one of the foregrounding virtues that I would expect from any healthcare worker is that of compassion. And when Dr. Mirembe was speaking, there are some issues. I quickly looked up statistics and found that just in terms of the numbers, that what is written is in public health facilities in Uganda, it is medical interns who provide the bulk of care. So in national and regional referral hospitals, they provide between 60 and 80%. 60 to 80% of the care work in these national and referral or regional referral hospitals. So the main hospitals that are providing.
Actually, Dr. Stella, to give you some information, to just add a little before you proceed.
Yes.
For me, I did internship in Kawempe and Mulaga and Chiludu. Those are the ones which have higher staff. They have a lot of consultants, they have a lot of medical officers. But when actually you cross up country, that is where the intern doctor does almost everything. The senior simply comes and asks, what are the complicated cases? Such that I can look at them. Because if he chooses also to see the entire ward, he will not leave. And he's a consultant. His job description is not actually to see every patient, is to see the complicated. But the intern doctor does the operation, does see the patients, runs the outpatient clinics, and everything, of course, with support of the nursing team and every other skeleton of staff that are in the hospital. Thank you.
Right. Thank you for clarifying. So out of the 60 to 80%, I think for me that already the issue of regional, so rural to urban, Kampala, capital city, versus places such as Kapiripiti, or, I know, for example, that Gulu and Masaka, and Barara, which have regional referral hospitals, may have a number of the senior consultants, but the other hospitals and health centers 4 and 3 are really manned and managed by medical interns. So that's the first thing I wanted to say. So in terms of compassion, sometimes there isn't even a prerogative for mercy and compassion. You're the person who is frontline. And when people say frontline healthcare workers, it means asoke bwako, who all the takataka, all the people who present after
Right.
their statistics are taken by a nurse. If there's one, they then are sent to see these medical interns. And so, yes to compassion, but I think for me that the demand that is there's so much demand. I was looking at also statistics in terms of the doctor to patient ratio, and the World Health Organization recommends 1 doctor to 1,000 patients. Now, the statistics I got for Uganda is 1 doctor to 24,000 patients. Henry, right? I mean, again, Dr. Mirembe can come in. Dr. Mirembe can come in to sort of give a clearer picture of what's on the ground. But in terms of the research that's done, the caseload, these are people who are overburdened already,
Yes.
whether they are medical professionals who have graduated and are no longer called interns, they're through with the 1 year, or indeed the frontline worker who is the medical intern. It's 1 doctor to 24,000 patients. So the question about compassion becomes critical, particularly when it's taken away from the doctor to the patient and taken to the level, scaled up to the level of the governance issue, which is really my question and my concern. Uganda, towards our doctors, our medical interns, our dentists, our psychiatrists, our the entire, medical profession. What are we doing to these laborers, these servants? We expect them to be compassionate, but how compassionate are we towards them? If the doctor to patient ratio is 1 to 24,000, and then the bulk of frontline work is done by medical interns, but we can't even have the compassion as a country, the leaders, the people who budget, the ones who make policies such as the National Education Policy for Health Workers. What are we asking? How do we imagine the laborer called a medical intern, if they're going to do so much in terms of receive all the sick bodies and mainly refer the severe specialist cases that need specialized care to the senior consultants? What are we saying in terms of mercy and this is dehumanizing. I feel that the country is dehumanizing our medical interns, our healthcare workers. And so in terms of the question around compassion, who's supposed to be compassionate to the other? What does it mean to turn a medical intern into a robot, a machine that just in terms of the workload, especially if they're doing so much work and they're not remunerated? I think there are questions there, but it sounds like you want to interject, Henry.
Well, I want to interject, but also Dr. Mirembe wants to interject. I think what has been happening on Uganda's political landscape is that many doctors have been deemed to give sacrifice to the nation. There's that phrase that doctors should sacrifice for the nation. They should be patriotic by serving the country. So by working for free, they are serving the country, right? And then that means we have to interrogate the concept of compassion versus sacrifice, and who gives sacrifice. For instance, who decides what is sacrifice, when it should be given, and to what extent should that sacrifice be valued as enough in order for a doctor, an intern doctor, to be deemed worthy of being paid. But Dr. Mirembe also wanted to interject. Dr. Mirembe, what's your intervention here?
No, I just wanted to add just for perspective purposes. I was here and I remembered a conversation I had with my mother. Now, when I was throughout my life, my mother has been close for just, I think, one reason, that whatever I wanted, she showed me that she's willing to provide, even when she failed. You could see an effort. So when I was finishing 3rd year of medical school, that's the year when you really interact with patients. Your lecturers take you to the ward, they are standing there, you are seeing patients in their presence, you get it. You present to them. That's now the teaching and probably the internship that other people refer to when they want to vulgarize this conversation. But I went home and told my mother that I will never work in a government hospital. And he said, why? Government, and I told her, no, I don't want. And I told her the reason was very simple. The life there was very painful, very dehumanizing. Why? You could get a patient, Henry. You clerk as a student, your lecturer and the consultant is there. You present a plan, the lecturer modifies it and tells you this is what we're going to do. So communicate with the patient when I'm hearing what we're going to do and tell them what it takes. Then you communicate. Then this patient doesn't have money. Then you see phone calls of calling home to sell a plot of land, to sell a cow, to sell a goat, and the like. So they take like 3 to 4 days. By the time they bring the money after selling, the patient has died. And it happened not once, not twice, not 10, but it was the order of the day. Because the first day. So I felt like working here, I'm not going to do I'm not going to apply my skills right. But also, too, there is too much pain for some of us who are compassionate. Of course, medicine has been categorized or stereotyped as a call. You know, a call is a conviction rather than just being a profession. But there's developing actually a movement for the last 10 years to shift from the call to profession. Why? Because governments are using the call perspective to dehumanize, to disrespect, not to provide resources for health workers to do their work. You get it? They just say be patriotic, be human. So we are shifting, and I think the conversation is even locally here ongoing in Uganda. To shift from that, so that they can know that we are professional, we are here to work. But as we work, we need tools, we need resources, we need also to be paid like others. I was told last week that Minister of Finance pays its interns 3.5 million net interns who go there to do internship. So what is the risk that interns that face when they are working at the Ministry of Finance? Money is going to fall on them. What is the risk? Then the same government doesn't want to pay 2.5 million to someone who takes a risk of getting TB. Very many interns every year get TB. You get TB. At least these cases are confirmed because they are working in these TB wards. They are exposed every day. Others are getting needle pricks. They are on PEP for HIV and so many other things. Those who do internship when they are old, they leave when they have their backs are almost growing because the work is too much. So I think from the perspectives for me as an individual and what I've seen young colleagues go through, there is need for a shift in everything. Thank you.
Your thoughts, Dr. Stella?
Yeah, I mean, I think it's important that the medical doctor is actually speaking because he was also a medical intern. And this question about compassion and sacrifice and call, he's introduced a new layer of the calling, is an important question. I think for me that in terms of vulgarizing, therefore, I want to then address myself to the question of patriotism. What does it mean to be patriotic if one is asking a medical intern to work without food? Okay, I mean, when Dr. Mirembe was speaking, and I think he speaks for a number of average Ugandans whose parents pay for their education as medical students for 5 years, Henry. So in terms of sacrifice already to become a medical doctor for the MBCHB or the Bachelor of Medicine and Bachelor of Surgery degree, the first degree that medical doctors do, 5 years. So in terms of sacrifice, they already go a lot longer than most of us who do 3 years if you're doing a bachelor's in, arts or education or even science. The medical doctors even go longer than engineers who do 4 years. and so in terms of sacrifice, already parents are putting in so much. In terms of sacrifice, I think that the other clarification one must make, that a number of us who have done internships who are not medical professions, is the distinction between what an internship in our professions does and what an intern doctor does. Yeah, because I think a lot of the confusion for policymakers, for members of parliament, for the education policymakers who sat and made that policy last year in 2025, the ones who are headed by Janet Kataha, many of them understand internship to be part of the education process. And so the people who are sent as interns, if you're a journalist or a teacher or even engineers, often these are people who have not graduated, they haven't completed their education. It is part of your extension, your practical work, to go and get some practical experience before graduating from being a student. And so a number of interns in Uganda, but also elsewhere, are still students, and we go back to our universities to do our third year or to do our final exams, which are then compiled. And so internship for many of the other professions is part of the student workload, right? Now, a clarification that must be made time and time and time again, and I think I never get tired of making when I'm talking about the medical interns in Uganda, is that a medical intern is not a student. In terms of sacrificing, they have done their 5 years, they have done their, clerkships and their attachments, and they have graduated as medical doctors. They already have the MBCHB. And so when one talks about them as students who need to be doing this one more year and requires that a university has to then supervise and grade and assess their performance, one is conceptually mixing what an intern doctor is with what the other interns are. And so in terms of sacrifice, intern doctors, medical doctors have already done the work to graduate. And so I think it is exploitative, but also debasing and also undervaluing their status as fresh graduates when one refers to them as students still doing internship and therefore not qualifying for the money. So whatever the policy that was written, whatever conceptualization it has of medical doctors, I think we need to sharpen the clarity that banosibana basomero, they're no longer students, they are graduates. And so in terms of sacrifice, one has already made so much sacrifice just getting to the level of finishing 5 years. And I think that the other important thing in terms of sacrifice and compassion and calling and patriotism is that many times our medical interns are posted outside Kampala, outside the city or the district where their university, where they undertook their studies was, right? So in terms of patriotism, many of them travel away from home, away from their known environs, and they have to rent a house. They have to find a market which sells cheap food. They have to find new, rent, food. I don't know about access to medication, all those basic needs. They're getting a new home for the duration of time, which is for some people a year. They are medical interns. So without the facilitation or payment or financial remuneration by government to these fresh graduates who are no longer students, right? As a parent who pays education for 3 children, after paying for 5 years and my child graduates with a medical degree, I don't expect continue paying for their rent and their food and their airtime and their, the everyday things that make a person human in order to serve. right? And I think why I call it dehumanization for me, and the exploitation is refusing to look at the conditions under which these fresh, brilliant minds are sent and posted to work at hospitals. Now, unlike senior colleagues or senior consultants, senior physicians who may have private practice, who may have clinics elsewhere, many times the medical interns the hours of their shifts do not allow them to have a side chair, a side source of income to meet their everyday needs. And I speak for me not about a car. I'm not talking about
Right. Yeah.
fuel for, I don't know. I'm talking about basic food, shelter,
Yeah.
transport from my home to the hospital, transport from the hospital back to my home, security, airtime, everyday things, basic things, soap, money for soap and water,
Right.
for
Right.
touching
Right.
your sick bodies. And so,
Yeah.
in terms of sacrifice, I think that putting a young doctor at a place where they're impoverished, like they're totally poor, and
Yeah. Absolutely.
without, we're giving them begging bowls to go and beg for their basic needs. And I think for me it's unacceptable. Many times the hospitals where they are sent do not have housing facilities. If there was a house, doctor's mess, where there were free meals provided, 3 meals, okay, 2 meals, if there was public phone call facility or whatever it is, if there was supplies given to them to meet basic needs of hygiene and sanitation and sustenance, perhaps we would send them without remuneration, right? But
Right.
in terms
Right.
of sacrifice, I think they're already sacrificing too much. And maybe the last point I will make around that same point before I go to Chris Bariomusi, the point I wanted to make about Chris Bariomusi, the small other point for me is sacrifice does not mean sacrificing food. All of us have rights to these basics, basic needs of food, of shelter, of whatever it is that people need to live. And I think
Maslow's
that
hierarchy of needs.
yes, that
Yeah.
that those basics will not be taken care of by parents. No, that must be undertaken by the government, which is posting them to these hospitals. And so in terms of commitment, I think for me, yes, the calling must be there. Yes, the sacrifice has been made. Yes, one of the things I think for me is that the question of human dignity that you touched on when you were introducing is important. What does it mean to look at these lives of doctors as human lives that matter?
Yeah.
Where does dignity come from when a doctor has to work so hard and they're giving us the hours, but they won't have a meal to go back to? If they go to surgery and they're working on all these cases, who's to say they will not begin asking for money for their services and not paying attention to those who are able to pay higher if we don't give them the basic take home? And I think for me, therefore, that questions around corruption and bribery, we are tempting our medical doctors and interns to indulge in inappropriate means of funding their sustenance if we don't provide the basics. And then we shall complain
Right.
that medical
Right.
interns are asking for bribes, medical interns are privatizing healthcare. But we are pushing them as Ugandans to do so if we don't push our government to take care of them. Now, my point, which I wanted to make about Chris Bariomusi, and it takes me to the question around who must we deal with without mercy. I think that Ugandans must be very merciless around these ministers of health in Uganda. We must stop treating Dr. Chris Bariomusi with kids' gloves, particularly because Chris Bariomusi has been a minister of information and communication technology. But before that, we know that he's always been a medical doctor. And in 2000, so 26 years ago, Dr.
Right.
Chris Yomunsi led a strike
Mm.
about low payment of medical interns. And he was a medical intern and a youth leader himself at the time. And so he
Right.
knows the pain of being a medical intern who must organize other medical interns to say, no, we want payment, basic payment, basic. Well, they're not asking for too much, just basic. And I think for me that therefore it is hypocritical for him in 2024, when he was still Minister of ICT and National Guidance. He's among the people who announced that the government would be paying much, less delayed remuneration to medical interns. December 2024, I've looked it up. 2021, yeah. So last Chisanja. Now this year in June 2026, he defended this new policy made by cabinet that proposed to scrap allowances for medical interns. Okay, so we see him in 2000 being a student leader, being a medical intern, being a youth leader, leading a strike and organizing. We see him in 2021 announcing a cabinet resolution to delay the payment of allowances. And now we see him in 2026 defending that policy. After he faced a lot of backlash, we now heard him changing his stance and saying he would present before cabinet a paper that would review the policy, and they would consider the decision not to pay interns. So in terms of where we need to put emphasis, for me as an organizer, as a mouthpiece, as a government irritant, I irritate the government, is to criticize people such as Chris Bariomunsi, who are knowledgeable about what it means to be a medical intern, who are knowledgeable about how our health sector works in terms of the laborers, the brains and skilled manpower who are providing healthcare to Ugandans. And it is our duty to push them back to a point where he was in 2000 as a medical intern. Ajjukire gye yava. Mulimu gwaffe nga bannayuganda omusindiikiriza aleme kwerabira nti nno byalwanirira mu 2000 nga student bye bikyaliwo. The situation still pertains in terms of the caseload, the workload that these frontline health workers, medical interns are faced with. So in terms of no compassion, no mercy, no bending, no stopping to scream and shout and plead and advocate and lobby and petition and organize, I think that it's the duty of every Ugandan today to engage with the questions of the day. That is where we have to show no mercy. There's no patriotism in this policy that was made, because the people who made it, I think one of the criticisms I've had again and again and again is that they did not undertake ethical stakeholder engagement. So if they're going to review the policy, which they must review, Chris Bariomunsi we must either partner with him or push him to be at the forefront of negotiating new terms for the medical interns. So no mercy there, no compassion.
No compassion for the policymakers, especially the doctor who used to fight for the medical interns during his years as a student leader and a student organizer. I think even now that he's in these spaces, especially now that he's at that discussion, the decision-making table, he should remind himself of his days as a student leader, as a student, and as an organizer, and continue prioritizing the medical interns. But two things that have really struck when both of you spoke. I think what we see in what is happening is a divide between the rich and the poor, and I say this because I want us to imagine two medical students or two medical graduates. One comes from a wealthy family, and one comes from a family that is striving to take a child to school. They sell land to take their child to school. And then a child goes to third year and they're almost dropping out but because they cannot afford to sustain an internship because they have to pay for themselves. So a child who's coming from a wealthy family is able to sustain an unpaid internship because he's not doing anything out of his pocket. He's not working from lack. He's working from wealth. Their family can provide them with the resources to manage an unpaid internship. And then there's Dr. Mirembe, whose mom struggles to pay, even to complete some of the required resources that are needed to complete a course as both as hectic but also as expensive as medicine. So when we look at these two, one of them is thriving while the other is just surviving, right? Where does that put medicine as a specialization? And how does that connect with indebtedness between these two students, right? So for Dr. Mirembe, how, given that you are in this sector, if you are to make a suggestion, how many talented doctors has Uganda quietly lost because the system became financially unbearable?
Yeah, Henry, and maybe as Dr. Mirembe comes, I think he should clarify. What I know is that the medical interns do their internship in after their fifth year. You seem to say it's after the third year, but could Dr. Mirembe clarify this for us, please?
I think they start interacting with patients in their third year, right? So once you start interacting with patients, you become customized to some of the duties that you do as a doctor or as an intern. So by the time you're in fourth year, I think that's when you start your internship. But yeah, Dr. Mirembe, what's the procedure there?
Oh, thank you very much. Just to clarify that, you start interacting with the patients, training with the patients in third year. Earlier, in year 1 and year 2, you are working with dead bodies, you're working with models in simulation laboratories, you're working with lab experiments, among other things. In third year, you go to the ward and start being taught bedside by the lecturers, consultants, and professors. The same thing happens in year 4, the same thing happens in year 5. So in year 5, if you have fulfilled the requirements, you have passed the exams, everything, that's when you graduate. And for us in medicine, year 1, year 3, year 4, year 5 are not called internship. That's the training. But in other, when you want to compare this medical training with other professions, that is now the internship the other professions actually do. Because year 1 and year 2 is for acquiring knowledge, knowing the medicines, knowing the diseases, the pathology and everything. Now you go in year 3 to start applying, being taught bedside, incorporating the knowledge you learned in year 1 and year 2, and now you begin putting it into practice for 3 years. Then that's what confirms you to graduate. When you graduate, that's, you know, the word internship in medicine it means something very different. Because, for example, a specialist, a consultant who works in IC is called an internist. Okay? You get it? So it is be used, of course, the other people are misusing it the same way Senior Stella said. But now that clarified, I want to thank Dr. Stella actually. She has built a very good fact-based case. The case of Dr. Chris Baliomusa, and I think Henry, you should cut out that clip and share it such that we can even share it widely, because at least she has said everything the way it is. And to add on that, actually, when Dr. Chris Baliomusa led the strike, the salary or the allowance, whatever it was called that time, was doubled from 90,000 during that time to 180,000, was doubled. And he enjoyed it himself. So when we go to the case of the poor versus the rich, that is a very delicate path that some of us and many people actually believe. I think it was last year or the other year, the same thing was brought up, and the permanent secretary put up a call that those ones who can afford can send her email, and she deploys them when the parents should confirm in writing that they are going to pay them the salaries. About 30 people turned up, and they were deployed. Their rich parents paid them millions of money, and in fact, the other interns found them. It reminds me, I had a very good friend now, a roommate then. His mother could hold him and ask him, I'll use another name which is not his name, Ntambi, sente ze nakuwa wichewedde zikyaliwo? Then namudamu, mama, sente zikyaliwo. This is a real story. He's like, doesn't it go to sample? You get it? So there are those categories of people. We have them, and I can tell you they are there. But then the policy, government should not be looking at there is a normal distribution curve in the community, as science will believe. The small positive of around 5% and the bad negative of around 5%. But there is this general wakati yao, So government should be looking at the normal distribution curve before it passes policies. And this particular policy that Dr. Stella has talked about was hatched by two people, Dr. Jane Ruth Acheng and Dr. Dana Atwine. Then they had to find a way where to pass it, and they had to go and force a buy-in from Ministry of Education, because they thought this would be their golden deliverables to the powers that be, that they would deliver that they have cut costs. You get? For them, theirs was a worship project of we have cut costs at ministry by not paying these people. This around 50 billion, which was going now, it's not going to be spent any more. So they wanted to feel worshipped. And of course, Chris Baliomusa came and also joined the caravan, but then he realized the caravan was a bad one. Several elders had to call him and ask him what he is really doing. So, of course, he has said he's retabling to cabinet. It's good to reform when you have been going astray and people call you to order and then you accept the order because it is the right thing to do. But now, we have not seen a commitment from government about all this. The vice president said they are reviewing the policy. But I can tell you they have not invited Uganda Medical Association in the so-called review or writing a paper to cabinet. They have not invited the leadership of the pharmacists. They have not invited the leadership of the nurses. They have not invited any interns or pre-interns. They have not invited the university vice chancellors or the deans of medical schools, whether government medical schools or private. They have not again invited everyone. Now they are revising a policy. Again, the very people who framed the crafty, draconian, evil, non-starter policy are the same people revising it. why don't they invite the leadership of the Uganda Medical Association? Why don't they invite the educationists on ground? The educationists on ground are not seated at Ministry of Education. They are the deans of medical schools. They are the directors of these hospitals. They are the consultants who train and teach these interns. They are the leadership of the advocacy platforms of these doctors, but also PSU is formed by an act of parliament. So they have not invited even the medical council. In fact, I should also say this. Ministry recently, the PS, invited the leadership of the medical councils. And in a meeting, this is what he told them. I know you think you have come here to advise us. No, you have come here for us to communicate to you. So I don't expect you to argue. She communicated and closed the meeting. So they threatened the leadership of the medical councils because they also not in support of this policy. You get it? Because they know it is fraudulent. It's not acceptable. It's going to distort the program because they have been building a momentum for East Africa, all the East African countries, such that a doctor in Uganda can freely go and practice in South Sudan or Rwanda without any regulation disturbances. Such that the training standards are the same because we are trying to form a college system whereby the training standards across Africa are the same. Such that we can have even that free movement of labor in the medical field and all other things. But this policy actually is against all that when you read it in its totality. And everyone who is senior, who is responsible, who is technical, who loves the quality of the care is against it. And if they have read it, they are against it. But there are two people, Dr. Dana Twine, insisting, manipulating process such that the policy is not reversed. And that is very bad. I think such people like seniors like Dr. Diana should look at the examples that are living. People talked about the sovereignty bill. Someone smuggled it. Even when the entire country said no, the person who smuggled it can't freely even leave her home currently. Even when she is sick, she has to seek permission from somewhere. So she should not think that she is special. Her and her team should know that fate is a double crosser. She can be dealt with by the same government that she is trying to appease with manipulating an entire niche of doctors, of nurses, of professionals who are diligently serving the country. You get it? So I think that's the issue. And I should applaud Honorable Bariomus for tracking back and trying to listen to the people. I hope that he takes the right proposals to cabinet this time, that the cabinet will pass proposals that are supporting patient care, that are supporting the welfare of doctors, that are supporting the welfare of nurses and everyone else in the hospital environment. Because I can tell you, we see sad people every day. Those of colleagues who see patients every day, they are seeing sad stories every day. And they are not immune to getting depressed, psychologically disturbed by these very stories. So you cannot add another burden, okay? You cannot add another burden of poor, extremely poor, because anyway, it's already poor, but extremely poor welfare, remuneration, and all other things. So I want to ask whoever is concerned, Dr. Chris Bariomus, take that path. Invite the leadership of the medical associations, have a boardroom discussion, break down this policy piece by piece. That should be what should inform your cabinet policy paper that you're going to present. And the evidence is there for everything we say as Uganda Medical Association. If we are talking about the workload, the importance of intern doctors, that is documented. Even Museveni himself, actually, he documented it in his letters he wrote in 2021. The Parliamentary Committee on Health has documented that over and over again. The importance. In fact, Parliament was saying, that was 2021, 2019. And then I was actually leader of medical interns. I presented We presented a petition, and for them, they wanted the intern doctor to be paid the same salary as the starting medical officer and public service. They wanted to reinstate the appointment on probation of intern doctors because of the immense work they are doing for this country. This country is not willing, first of all, to recruit at the required minimum number of doctors in its facilities. We have facilities where staffing is at 5%. For example, those regional referrals don't have ICU nurses, don't have ICU doctors, don't have specialists in anything. It is general doctors working there, and maybe one or consultant who is suffering a lot. And when you compare, if you have seen Agora statistics, those statistics are real, and they are not based on any other investigation. They are based on Ministry of Health data. Ministry of Health, its own data. Now, if their own data is that bad, what if someone did an independent investigation? How would data look like? You get it? If, when you cannot score yourself with a 50%, most likely someone else can't even score you with a 30% or 20%. So the issue here is there should be political will to prioritize and make sure that the wananchi get quality health care. This issue of interns is not just for doctors, it's for all of us who are not rich enough to go to private facilities to get care, including us doctors, including the educated, the uneducated, all of us. But if you are rich, I can tell you when an emergency comes, it doesn't ask whether you're rich. That doctor is one you will find at the government facility. This government, for example, about 4 years ago, they passed a resolution to put 2 doctors at every health center, 3. They have not put any since that time. They keep saying there is no money. I think it was from 2016 up to 2024. Government put a ban on recruitment of medical workers. And, the people were dying, who were serving. People were leaving the country. You asked about the urge, the loss that we are facing, actually.
Right.
That loss is very big, and I can quantify. In 2019, a study was done to ask medical students who are in their clinical years where they want to practice from. And over 60% said they want to leave the country. And the reasons they gave were the working conditions in government hospitals are very bad. 2, the payment is also below standard. 3, the facilities, the diagnostics are not there. Of course, this was informed in real time. Why? The survey was done among 3rd year and 4th year medical students. They had been exposed to the troubles. They saw their seniors struggling to save a cardiac arrest patient without defibrillators on daily. They saw how we were operating on a mother when all we have is literally our razor, the blade we used to cut, and a few sutures that have been bought in an opposite pharmacy. But most of the other things are not available. We are using ketamine, a drug that has been almost off-label because we cannot use the higher drug even when the patient can afford them. Why? There are no anesthesiologists who are experts in controlling the side effects in case they can. You get it? So they were exposed to the system. The system was bad. So I can tell you over 60% want to leave. But remember, I talked about a red list. The World Health Organization red list doesn't allow those well-paying countries to just recruit staff from this side, because everyone would want actually to go. So people who are living go through a lot of trouble actually to access licenses on the other side of the road. You get it? They have to go through a lot of re-examination, which is also very costly. Someone spends about 20 million trying to get a licensing across in other countries other than Africa, because they have to do exams, they have to do this, they have to travel on planes to go and do those exams, they have to come back, they have to do some retraining, just to the other people to be sure that actually you train. They don't trust this side, because and of course the way they see us run our things, how our governments, because for them they depend on government data, among other things. So that's what I can say for now. Otherwise, people actually want to leave. People want to leave because situation is not really favorable. Of course, I should end with this. This government is saying currently is fighting corruption. This government is saying wants to provide services. But when we, Uganda Medical Association, called out and exposed these things, we are targeted. Our jobs are targeted. We cannot even work in actually government because you find that they have listed the doctors who qualify for this. Your name is there and they have put not recommended. You get it? Wow. You get it? Not recommended because you call them out. So we shall get an example. People who called out Parliament for corruption. Some of them are still in prison. Others are on bond, on bail. They were arrested. Yet the same now are saying they're fighting corruption. So government should stop the double standards and listen to the experts. Countries are developed by expertise, not by a rhetoric speech, not by running around like a headless chicken. The health sector will not develop until when the experts are given their space on the table. The politicians have got to listen to us, because for us, we mean well. We are not after even their positions. We want to help us. We want to help the community. Because when I say us, I mean the community, because our own mothers, our own children, our own friends are in that community. So the time is now for government to stop the talk, to stop the pretense, to get to work practically. The first sign that we are going to see is when they call the stakeholders to review this policy and align it. Because it is more that we have a policy that is combined, that is comprehensive. We actually want the policy. It is us who continuously call for the policy. But how do you develop a policy from your bedroom and come and force it on an entire population of over 500,000 people? An entire population of 50 million people in your bedroom? That is not acceptable. It should stop, and the right channels should be used to develop the policy, make it a fine document, acceptable, implementable. But as they do all that, they should not attempt to think about not paying anyone providing a service to Ugandans. So personally, I will leave the side of doctors and join the side of now the patients. We shall push back against any unpaid health work in our hospitals. We cannot accept that. We, the patients, and the relatives of the patients, we, the friends of the patients, are not going to accept any doctor, nurse, pharmacist who is not paid to come and treat us. They will be more dangerous to us. They will cause us trouble. They will be thinking about food, thinking about rent, they will come dressed poor and we shall even not trust them. They will get depressed psychologically. So this is not acceptable. We shall not accept it, and government should be aware. And I request every well-meaning Ugandan, this is our fight, this is our battle. Allow not government to send us doctors who are not paid. No way. Thank you very much.
Thank you so much, Dr. Mirembe. And I see the passion that you share these thoughts with. You're not just pushing back, you are explaining what is really happening on the ground. You are putting yourself into the shoes of the patient, but also coming from an understanding as a medical doctor yourself, someone who has been a medical intern yourself, someone who has been a leader, an organizer, and someone who speaks from the perspective of understanding both situations, both positions. You have intimated the disconnect between policy formation and policy implementation. This is real, not just in medicine, but we have seen it in education. We have seen it in the legal fraternity. The disconnect between policy formation and implementation is real. It's not just rhetoric, as you have said. It is something that is practical and needs to be talked about on a regular basis. Of course, this also trickles down to other sectors within our society, and it affects people from other fraternities, not just the medical interns or the doctors or even the patients themselves. But as we have seen, and I want us to intersect this with what happened to Senior Counsel Lukwago, who is now yearning to go to India for medical treatment, right? Yet he could be living qualified medical treatment here in Uganda, but because medical interns are not treated well, even consultants, when people become consultants in Uganda, they don't have proper resources to treat certain illnesses, because from the beginning, they have not been given the fertile land to develop themselves and to buy the necessary resources to treat all illnesses as they appear. And I want us to listen very carefully to Senior Counsel Kwaga. Listen to what he said when he was explaining his ordeal to the judge, who later sent him to the High Court. These are things that I think are very important for us to listen to, but also to interrogate the intersectionalities as they appear.
Munnamateeka Erias Lukwago olwaliro akomezeddwawo mu kkooti esookerwako e Makindye mu maaso g'omulamuzi Ssala Basemera Ani okuddamu okusomebwa omusango ogwekuusa ku kulya mu nsi olukwe. Lukwago abadde yakasimbibwa mu Kaguli, omuwabi wa gavumenti n'abuulira kkooti ng'okunoonyereza ku musango guno ogumuvunaanibwa bwe kwawedde. Omulamuzi Ssala Basemera Ani asomye obujulizi gavumenti bw'ereese obugenda okukozesebwa mu kkooti eno, nga kuno kuliko ensisinkano abavunaanibwa omusango gw'okwagala okumaamulako gavumenti ya kuno okwagala okutta omukulembeze w'eggwanga okuli Dr. Kizza Besigye Haji Obed Lutale ne Captain Dennis Ora, ng'oludda oluwaabi lugamba nti Lukwago yategeerako ku ntuula zino kyokka tewali wa buyinza mu ggwanga lino gwe yategeeza.
That on the 16th day of November 2024, KB Haji Obed Lutale, together with AW and his Kurdish contact, attended a meeting at 108 Riverside Apartment in Nairobi, Kenya, to further discuss the plot to overturn the government of Uganda by force of arms. The Nairobi meeting was attended by KB Haji Obed Lutale, AW and his Kurdish contact, who was posing as a representative of the Kurdish government company.
Oludda oluwaabi lugamba nti mu bujulizi muno Dr. Kizza Besigye n'abalala baalina enteekateeka y'okugula ebyokulwanyisa okuggyako gavumenti, era nti Lukwago bino byonna yabimanyaako kyokka n'afuuka kyesirikidde. Wano omulamuzi Ssala Basemera Ani waasindikidde Lukwago mu kkooti eno erina obuyinza okuwulira omusango guno.
In the same meeting, KB and JW repeated their request for AW to supply them with counterfeit Ugandan currency, drones, weapons and grenades, which they codenamed pineapples, but deliberately did not report to any authority.
Kyokka munnamateeka wa Erias Lukwago, Medad Lubega Segona, asabye omulamuzi okuwa olukusa Erias Lukwago atwalibwe mu ggwanga lya Buyindi mu ddwaliro li Fortis Hospital ono gye yasooka okujjanjabibwa.
We pray that while in India in hospital, he be afforded available consular services as a discharged patient under medical observation.
Segona asabye omulamuzi okukkiriza Lukwago okwogerako eri kkooti eno ku mbeera y'obulamu bwe, mwategeereza nti abasawo eddagala lye baamuwa terisobola kumuwonya okuggyako okukendeeza ku bulumi.
They are managing the pain with the pregabalin, gabapentin, all sorts of those medications, painkillers. That is the only thing they can do. But the recommendation was that I go back, they fix this, which they cannot fix in.
Ng'akulukusa n'amaziga alajjanidde omulamuzi okumukkiriza agende mu ggwanga lya Buyindi asobole okufuna obujjanjabi olwawozesebwe nga mulamu.
To handle this just getting the problem, so that I can also have sleep like you watch. I'm entitled to do that. Like any other normal being, I'm ready to be tried, but when I'm alive, I'm ready to stand in trial. I'm ready to defend myself. But how am I kept? Finally, you wash. Finally, you wash. And I can always even join the man. No problem. But when I'm alive.
Lukwago agambye nti takyalina kikozesebwa kyonna mu kwejjanjaba nga ne piro gye baamuwa okumuyambako ab'ekitongole ky'amakomera baagitta.
So that's the way it works. Now they removed the speakers and those other chips inside, which they are not the ordinary speakers. These are high-tech kind of whatever, which are inside there. So they dismantled.
Ono era asabye omulamuzi alagire gavumenti emugulire piro eno kubanga eyiye baagyonoona nti awatali ekyo embeera ye yakwongera okusajjuka.
For me, I'm incapacitated. Where I am even moving from the place where I'm detained into the reception is a terrible. But the government can work out mechanisms of getting me this facility so that I stop using these sedatives, which are not only addictive but dangerous to my life. Imagine using sedatives every night.
Kyokka omuwabi wa gavumenti amazeeko abantu mu kkooti ebyewungula bw'ategeezezza omulamuzi obutabaako kyakola ku nsonga ezisabiddwa avunaanibwa ne bannamateeka be.
That your only role right now, Your Honor, is transferring the file to High Court, and any other applications, prayers, and orders can be made there.
Omulamuzi Basemera akaanyiza n'omuwabi wa gavumenti n'ategeeza Lukwago nga bw'atalinaawo kyasobola kukola ku nsonga z'asabye.
At this stage, I cannot make an order referring the accused person to India. This can be achieved through an application of bail in the High Court, which has been done.
Tukitegeddeko nti Lukwago waakugenda mu kkooti enkulu okusaba okweyimirira kakalu ka kkooti, kyokka tekimanyiddwa ddi musango guno lwe gugenda kutandika kuwulirwa mu kkooti enkulu. Benedicto Mulondo ne Moses Junju, BBS Terefayina, Gambuuze.
Dr. Mirembe, why don't you tell us?
Yes.
Explain to the viewers the condition that Counsel Lukwago has explained in court. And after you explain that, tell us how that intersects with what is happening in Uganda today, where medical interns are not given remuneration, and that how that affects our entire healthcare system.
Yeah, thank you very much, Henry, for sharing that video. You see, that video, if you're a health worker, it causes a lot of pain. It causes a lot of emotional distress. It's traumatic because the role of health workers is to relieve suffering in a non-judgmental way, causing no harm. And I want to use this platform to applaud all the doctors from the intern to the senior consultant in Mlago who were bold enough to document the right things they found and make the right recommendations. Uganda, as a country, we are still far below on diagnostics, technology in particular. The experts are here. We have colleagues who are trained in this, but there are no equipment.
Right.
The theaters are not up to state. The MRI machine, CT scans, a lot of these generation, very old models, which are limited in doing things, okay? So that's why, in addition, of course, there is also fear. It is very hard if when you have a question on me and you have something against me publicly, that I will accept your care, okay? And the patient has rights on who treats them.
Right.
Even governments are not allowed by international standards to choose for anyone which nurse, which doctor treats them. Someone should seek care in a place they trust, with the staff they trust, and the capacity of those. So government itself knows it doesn't have the capacity to do the surgery that were done on the Road Mayor Lukwago. Not because the experts are not here, they are here, but the equipment. But also Lukwago is not a vulnerable Ugandan citizen. He's a very senior citizen with at least financial muscle to seek care from a place where he is comfortable. Because if he has made his money as a lawyer, who is he going to spend the money on? So I don't want to go into the details of his condition because I don't have authorization from him to really break it down for the public. But when you sum it up, okay, is a very sick man who tomorrow news can break that he died. And his death would not be that because there were no solutions to his troubles. The solutions are there, but they're not in Ugandan prison hospitals. They're not even in Mulago. They are somewhere across the country, in Kenya or in India, because those people have invested in the recent technology of making the operations in diabetic patients. You know, when you have these other comorbidities, they affect the quality of the surgery. So you need very high precision theaters, very high new technology, MRI machines to see the fine details. You need a PET scan to see the cellular level of things before you repeat a surgery in his back. We don't have a PET scan, even government, not even private facilities together have one. But these PET scans are common things elsewhere. You get it? We don't have one. In Kenya, of course, there are many of them.
Right.
So, for the healthcare of Lukwago, I want to applaud the doctors and the health workers in Mulago. They did their part. They were clear on their recommendations. But someone, a magistrate, who knows not even how Panado works, overturned a technical report. That report was not made by one doctor.
We seem to have lost Dr. Mirembe. We seem to have lost Dr.
Hello?
Mirembe. Oh, okay, you're
Hello?
back. Yes, you're back. You said that report was not done by one doctor. That's where you left us. Do you hear me? I think the internet is not strong enough for now. But we do appreciate Dr. Mirembe. When he comes back, he'll give us a full analysis, a full scope of the analysis as he thinks about it. Dr. Stella Nyanzi, you have seen that. Are you back, Dr. Mirembe? Dr. Mirembe, are you back? You can remove that video, maybe. You can just stay on audio to manage your data.
Yes, I think I can. I think talk now.
Yeah. Can you complete your analysis
now?
Yeah. So the last moment you said your last comment was that
I was
You
saying
know,
that
you can remove video if it's taking a lot
yes.
of data. It's
Are
just
you able now to hear me?
yeah, we are able to hear you.
Are you able to hear me?
Yes.
Okay, so I was saying that Lukwago is very sick. What's happening? Hello?
Yeah, we hear you. We hear you. Don't worry about yeah, yes, we hear you. We hear you.
Yes, so Lukwago is very sick as a person. He needs to be out of prison. He needs to get bail as fast as possible because clearly he described they even took away his pillows and his back is supposed to be supported. Even when he's at his own home, post that surgery, he needs special kind of treatment, a special kind of a mattress, a special kind of a bed, okay? Among other things. But when you see someone making jokes about his status as a doctor, as a profession, you can't help but cry for this country.
Thank you so much, Dr. Mirembe, for that analysis. Dr. Stella, we started this conversation by talking about compassion and how compassion really is the cornerstone of medicine. Yet compassion is also needed among both lawyers and judges to defend human rights and to uphold the rule of law. We see in that clip two powerful women, one a prosecutor, the other one a magistrate. We think that women are supposed to be compassionate. At least that's what that's the perception that most people have. By nature, women are supposed to be compassionate because they're the mothers of the world. When you hear a prosecutor doubling down that someone of senior counsel, Lord Mayor Emeritus Elias Lukwago, should not go abroad, should not be given bail to go abroad for medical treatment. What comes to mind? As a feminist yourself, what should we make of these honorable or dishonorable women of court?
Right. So the question of women in Uganda's politics is an important question. And I think I want to begin with two women that Dr. Mirembe talked about. So Dr. Diana Atwine and Dr. Jane Ruth Acheng are ministers in the previous cabinet. They were responsible for health, one as Minister of Health, the other, I think, Minister of State for Health. And they're responsible for the bad policy that is scraping off the allowances or stipend of medical interns, and they smuggled it in. And that policy is signed by another woman, Janet Kataha Museveni. So again, the question about women and women's empowerment in Uganda is an important question because we realize again what Dr. Kizza Besigye taught for a long time about those of us in the resistance, that at the end of the day, we're not going to be separated by our gender or our tribes or our religions or our classes or professions or age or whatever. There's one line that separates the oppressed from the oppressors. So one might be a woman and the expectation is that all women are full of compassion and mercy, and whatever we decide is for the good of the masses, the good of the people, the good of the poor. But clearly there are women who are oppressed and women who are oppressors. There are women who are working with the oppression and women who are working against the oppression. In terms of Lord Mayor Emeritus Salongo Alhaji Elias Lukwago, whose videos you've shared, I think that the question of compassion is an important question that maybe is not just compassion among doctors, compassion among state prosecutors, compassion among magistrates, compassion among lawyers, compassion among the leaders in the country. Maybe it's a question that has to be extended away from just the medical profession to our governance. So Erias Lukwago is a political prisoner. Erias Lukwago is not suspected of anything major. What we know is that the case of misprision of treason is really a case that is political, and it's now being forced onto the judicial system in Uganda. When Dr. Mirembe was discussing his illnesses, he said he won't go into the details, but I've been following keenly the court proceedings for Salong Erias Lukwago, and I want to confirm what Dr. Mirembe said, that there have been specialists from Mulago Hospital who in fact assessed Erias Lukwago on the instructions of the magistrate in his case. So at the time of his presentation, his lawyer, Counsel Medad Segona, applied that his client should be given referral from Luzira Makshon Bay Hospital to Mulago Hospital for assessment. And this happened. And just again to confirm what Dr. Mirembe said, there was a senior orthopedic spine surgeon from Mulago, a senior consultant physician, and neurologist, a consultant neurosurgeon, an associate consultant orthopedic and spine surgeon, and an ENT specialist who all reviewed Counsel Erias Lukwago. Their names are stated in the application that Medad Segona made on behalf of his client. Now, when Dr. Joel Mirembe says that Erias Lukwago is a very sick man, actually, the different diagnoses, the different illnesses that the doctors found when they checked his body are also given to us in court. So he has long-term hypertension, and to manage it, he's given antihypertensive medications that they can do in prison, right? And so there are questions around military medical doctors who operate in prisons, who operate in safe houses, who operate at the police station. Many times when we are tortured, these military medical personnel are the ones who take care of us, and many of them are posted in our prisons. But the ones who worked on him in Mulago Hospital were not military medical physicians. They were actually senior surgeons and neurologists, like I stipulated. So hypertension was found, and that can be controlled in the hospital, in the hospital, in all prisons in Uganda. I think what is more scary is that there was, secondly, unresolved post-COVID-19 lung complex, right? So he has issues with breathing, as most of us have observed many times when he was speaking, even when it was publicly or in court. He had these issues around breathlessness, and that comes from COVID-19 related condition that he got. And then there is persistent, like there was a whole thing about a tube that's not functioning in his esophagus or his throat, which leads to conditions. And then they talked about a particular hernia developing out of that, and that hernia makes it difficult for food that's been taken down to stay down. Many times it comes up, and if it's not food, it's saliva. If it's not saliva, it's gases. And so that's a new condition that his wife, in the dua that was made for him on Friday, said the family didn't know about. So there's a new condition. And then, of course, there were conditions around, olfactory dysfunction. There were conditions around mania, and I don't know what. And then there's another condition, residual cervical, about his discs that came from the disc replacement. And there were issues around a ringing in his ear. So the ENT specialist actually found a number of issues to do with his hearing. That's why he needed that hearing gadget, which is because of medical prescription. So he had that tinnitus pillow. The pillow he has is prescribed by doctors. It is not available in Uganda. The pillow had to be ordered from the UK, and the prescription was made in June 2025, so long before he was arrested. And so that pillow, the prison wardresses, wardens claimed they dismantled the pillow because it had recording gadgets, right? But the pillow is actually because of that ringing in his ear, and he cannot sleep. So another condition that arose within this period is Erias Lukwago cannot sleep because that pillow which aids his sleeping was taken away from him. So he's suffering from insomnia. So the seventh condition they told us is insomnia. Now to sleep, he then needs sedatives or medicines, and they gave us so many different names: domazepam, diazepam, bonazepam. All of them are prescribed in the prison facility to allow him to sleep. Now the problem, because he has the hernia and he has the gastroenteritis, like when he eats food, he doesn't stay down, and because of all these things, he then has issues with his stomach arising from the hernia and the effects of the sedatives. But he needs the sedatives because his tinnitus pillow was dismantled by the prison because of security, right? So hypertension, cervical spine illnesses, the hernia, the unresolved post-COVID-19 lung complex, all of these conditions make him a very sick man, right? And this is public information because of the court process he is now subjected to. And I said the court trial is a political trial. It's persecution by the executive using the judiciary, persecution also by the military command of the CDF, right? Now, I think for me, when you talk about compassion, is the magistrate who ordered Erias Lukwago to go to the High Court, does she lack mercy? I think that we've talked for a long time about our judiciary being besieged and held captive by the executive and by Mushozi's military dictatorship that's unfolding. Okay, what does such a woman do? I think for me that referring Erias Lukwago to the High Court is sort of following what happens. One of the things I'm glad about is that it has happened very quickly. Many people who've been charged in Uganda for these capital offenses know it can take up to 2 years to get committed to the High Court. And a person is just in between prison, and if they're lucky, they come to court without being committed to the High Court. And we heard Erias Lukwago saying, I am now a committal. I am a lodger waiting for my file to be brought to the High Court. I'm not even going to ask for bail from you because the process can now only be undertaken by the High Court, right? Erias Lukwago, his bail application cannot be handled by anyone. Now that he's been committed to the High Court, it has to go to the High Court. Now, between being committed to the High Court and his file actually being taken to the High Court is punishment for Erias Lukwago. A medical doctor has told you he's very sick. For me, I have repeated what was read by his lawyer in court. Okay, we observed him fighting for rights and speaking out and organizing in political parties and running for campaigns. But he actually was a very sick man. And I think in terms of compassion, I want to pause and ask Ugandans. Many of us are healthy. We don't have a single illness. All that can be diagnosed is some flu, maybe. Okay? A bit of thirst. Dehydrated. But many of us are very healthy and we are so uninvolved. Totally not concerned about changing governance, raising our voices, standing on our professions to call out misgovernance. Erias Lukwago was a very sick man. They read all these
and he's fighting for your rights.
I said, oh my God, this guy is very, very sick. But despite his different conditions, we watched him every day showing up, every day speaking out, every day organizing, every day, doing this. So in terms of compassion, I think that I want to call us as Ugandans to remember that many of the freedom fighters who are doing the work we are leaving them to do, we've abandoned the work of fighting for our freedom with other people. But as we've just witnessed, one of the people at the front line is a very, very sick man. Very, very sick. Muyinyo, even to sleep, he needs a pillow with funny gadgets that needs to be charged. Right? Just to sleep. Okay? So in terms of your question about women and women's role and feminism, I think for me there are maybe two issues I will end on. That not all women, simply because one has a vagina, it doesn't make them more compassionate, very peaceful, very, I don't know what. The work we have to do is to continue teaching. This is where I come in as an organizer, as a leader. Continue teaching even to the women, because their compassion may be misplaced. They may not know what their role is, especially these privileged women who are like empowered women. We have to continue teaching them that the expectation is that because they're women, they're going to be fairer, they're going to defend the rights of poor people, they're going to be more peaceful, but clearly they are not. And it's our duty to keep on pushing them and teaching them and telling them and calling them and criticizing them, but also thanking them when they do good. So the magistrate, I think for me, she allowed a referral to Mulago Hospital, where Erias Lukwago was reviewed by these very senior specialists in Uganda, a spine surgeon, a neurosurgeon, a consultant physician, a neurologist, an orthopedic spine surgeon, an ENT specialist. All these are like Uganda's top of the top, cream of the cream, and they're at Mulago Hospital. And they gave this health care and assessment to a prisoner, right? So that's the first thing, that actually there are women who, even when the judicial system is captured, they still find ways to make good. So we can't argue that Erias Lukwago, Kozesa, he's a malingara. Many senior doctors, and I like that they were in pairs, they gave opinions together jointly that confirm he's a very sick man. Okay. Now, so some women are still finding ways to make the system work for justice and truth. And what the doctors then said is, we refer him to proper healthcare workers. The referral was taken to prison medical military staff at Makshon Bay, who said, yes, you're a sick man, but the prison facilities do not have, we don't have the things that you need. Your tinnitus pillow. Okay, we understand your tinnitus pillow is a prescription, but we don't have it. In fact, we don't have it in Uganda. It's brought from the UK. All these things about your discs, we don't have them. And they referred him back to India. So the task is now back in the hands of the cruel, oppressive executive and military, which ordered for his abduction, and it eventually threw him in the police station in Chila Division, and is now in prison. The important question now is that Medad Segona applied to the court to refer Lukwago to India. Omusajja mulwadde nnyo. Tetulina bye tusobola kumuyamba. Mulwadde, fine, you want to imprison him, but he's very, very sick. The only way we can support him is to give him a guard, similar to the guard who guarded him in Mulago Hospital, to go with him to India so he can get his medical treatment. So the question now for me around compassion, the big topic we've been talking about, compassion for doctors, compassion of ministers, of the president, of cabinet ministers, of policymakers, of stakeholders. The question now is compassion that extends even to prisoners.
Right.
Do prisoners have a right to health? There's a sick man such as Lukwago, who is accused of misprision of treason, who has all these conditions. Does he have a right to health? And I think the question then is going to be, there's military brutes who abduct us and torture us and throw us into prisons and courts where our illnesses are amplified, diagnosed, and made public. Can they afford the cost of what it means to abduct sick Ugandans? Are we going to ask for mercy and compassion from Muhoozi or Museveni to issue an air ticket of a guard from prison to go with Arias Mukwa to India? So the questions are coming back to the state. And those are important questions. Bamusibanga muradde. Abasawo bagambye omusajja mutwale India nga mutadde ku mpingu.
Right.
Kati bibadidde. Can they afford it? And I think it's the very same question. You made a policy about medical interns. Ngabulaba. But the medical interns are treating the very poor voters who voted for you. Tuduchisanja hakuna tugo. Okay? Can you afford to continue having no compassion and impose your leadership on us? Are we asking our oppressors to be compassionate? I think for me, it's a question that we need to think through. What does it mean to have medical interns who are begging to be paid? What does it mean to have Arias Lukwago who is begging to be taken to India? It's the same question. Total dysfunction. Governance misfunctions. We need to liberate ourselves, Henry.
Thank you so much, Dr. Stella. And I think you ask a very important question. Very, very important question. Can a government that fails to pay its medical interns afford to pay guards to escort sick people to hospitals abroad?
Right? India. To India, better have visas and medical guard no more day.
So that's a very, very, very important question to interrogate. Dr. Mirembe, I'm going to ask for your response to what Dr. Stella said. But as you respond to that, I think you should also respond to Nalunjoji Joanita, who asks that can private universities sponsor internships for their students? Which means that now even for students who are brilliant, who can be admitted in private schools on scholarships or grants, can they qualify for that kind of sponsorship from rich private universities? Because I think people are giving up on government universities because they don't seem to care. But your responses to Dr. Stella, her questions, they have been interrogated, because these are very important. And I think it's important for us as we question, as we engage in questioning what is happening, what is being done, to also offer recommendations. What are recommendations? What should government do? Who is responsible? What should they do to ensure that they take care of medical interns? Because when medical interns are taken care of, the population is taken care of, and we won't have sick prisoners, because prisons seem to be the destinations for most Ugandans who seem to express themselves. Your thoughts, Dr. Mirembe?
Yeah, thank you very much. Thank you, Dr. Stella, for that elaborate discussion on the issues surrounding the conversation for today. But before I even comment on what Dr. Stella has said, Naram George is asking whether private universities can sponsor internship for their students. But Naram George should not forget that people go to private universities to study medicine and they pay money. They don't only just pay money, they pay expensively. In fact, the tuition in a private university to study medicine is on average 10 times the tuition one pays in a government university. For example, the cheapest government private university pays tuition alone, 7 million. Yet, in Barara, Gulu, there you find that medical students are paying 1.5 million, maximum around 2 million. Okay? So, it is very expensive to pay for a medical student in a private university. So, the same people asking for that lot of money, that means because they are investing in equipment, they're investing in recruiting teachers, they're investing in administrative costs, among other things. Of course, also their profit, because these are private for-profit institutions. You don't expect that they will pay the intern. But also, you should know that internship is not part of the university's program. The curriculum that trains medical students doesn't have a section for that. The curriculum aims to train a complete, able person, someone who is able to treat. Internship is another program which is just part of career development, career path. You get it? So there is no way of pushing that to private universities. And if government wanted that, it has to, first of all, go back and review the entire curriculum. Add the so-called internship. And that review doesn't take a year or two. You have to make sure that the new curriculum applies to people who will go to medical school when you have reviewed the curriculum. So it doesn't include people who are already at medical school. So that means you need a minimum of 5 years from the time of reviewing the curriculum and incorporating whatever good or bad you want to put. So that, I think, rests. And no one can do internship internationally when you don't have a license. You must first apply to the council, medical council of your country, to give you a license. And the council cannot give you a license when you're a student. Medical councils across the world don't deal with the students. The only way they deal with the student is at the regulation of a medical school, because they visit the medical school to see how things are going. So this time, after graduation, you are dealing with the council as an individual, as a practitioner. So that's a very different thing. So going on the issue of Dr. Stella, I don't want to repeat what she said, but the compassion, I want to just add on what actually she said. The lawyers, the judges, the magistrates, it's really very lacking on their side. I don't say that our side we are very perfect, but for them, it is very bad. I'll even not use the counsel Elias's case. I've been in court the last 2 months, following up some 2-3 cases. And I have seen the sheer lack of compassion. Cases are being decided against those who are actually, the victims. Cases are being decided because someone paid some money to the magistrate, and the case is decided in favor of the payee, the person who has paid. Prosecutors are acting the same way. If you don't pay something, your case doesn't move, especially when it is government. Again, you are a complainant, but government is the one which is, the government prosecutors are the ones who are leading the case. There is a case, someone has been in detention for like now 2 weeks. But the reason why they are not being taken to court, because money is not exchanging what? Hands. So then when you look at the example of senior counsel, and I want to emphasize the word senior counsel, Elias Lukwago, who we all know, the entire country knows, the legal fraternity knows as a man who has been in the courts, standing in for everyone. They don't have even shame to make a decision
that favors the truth, that favors the facts, that favors the rule of law. They choose to make a decision that favors lawlessness. You get it? So there is something wrong with our lawyers, with the judges, with the magistrates. I want to use this platform to request the lawyers who are opposed to lawlessness in this country. They must have a coalition that is going to keep these lawless and compassionate lawyers, magistrates, and judges on their toes, that are going to continuously call them to action in the platforms, in the courts, everywhere. There must be any organized, deliberate advocacy against judges, magistrates who are committing impunity against our people. You see Lukwago's case in the public, but I can tell you thousands of Ugandans are suffering in the same way the way Lukwago is suffering, because of a call from above, because of money, and it is everywhere happening. I have observed this myself, and throughout these 2 months, I've always thought, oh my God, Lukwago is going through this, but then these are the people who can't afford a comment from the media. What are they going through? It is very terrible. The judicial officers accomplished in the impunity, in the lawlessness that's happening in our country. It is high time that they choose to be at least two, and the two should be known publicly. For now, we know there is a side that is complicit in lawlessness. There is a side, that side is complicit in impunity. That side waits for a call from above to make a judgment. It doesn't base on any facts, on any material provided in court. Because for Lukwago's case, even an ordinary person who has not gone to law, the magistrate asked for a report from experts. Experts provided it. She or he decided, opposite to the report, that they themselves, they are the ones who requested for the Mulago report. And the report came because they thought they are going to threaten doctors to make a report in their favor. The doctors stood their ground and made a report that reported the truth. Now, I think they made a lot of phone calls. They almost wanted to cause the report to be reversed. You get it? And the reason why I didn't talk about this report, not because I don't know it, not because I didn't speak even to colleagues, but there was a lot of politics surrounding not providing the true picture of the health status of Lukwago. You get it? But for us as doctors, ours is to treat everyone equally. If you are NRM, I'll treat you. I will not even think about my opinions as a critic of government irregularities. I'll focus on saving your life. After saving your life, we can have a conversation, we can have a fight about how this country is governed when you're alive. So that's our stand. And as Uganda Medical, we stand with that. We even actually ran a petition before Lukwago was examined that Lukwago should be given bail on medical grounds. We ran a petition for Kiza Besigye to be brought to hospital. You remember they had refused to bring him to hospital even when he was sick in Rosira. Yet in Rosira, there are no facilities to help him save his life. We did. When Eddie Mutwe was tortured brutally, I personally visited him on behalf of the Medical Association. We made a report and we sent this report to police. We sent it to everyone, to prison and everyone concerned, so that he can access psychiatric care, he can access psychologists. They should even release him. Yes, they didn't release him, but at least the treatment, he was moved from that Ramushako Health Center 3 to Zira, where there are some colleagues who tried to make his condition better. So for us as doctors, ethics and professionalism is first. Our colleagues, the lawyers, our colleagues, the magistrates, the judges should heed to that. Don't they have an oath they swear allegiance to? Why aren't they implementing? Why are they accomplices in allowing the state to torture us? Ssali, there are a lot we would have done But we are not doing it because we know anytime we are going to be picked. Not because we have even committed any wrong. Dr. Stella at some point mentioned it. People don't know what some of us are going through. Very terrible situations. You cannot access a job, yet you have the skills, because the potential employers fear that you call out to government to do the right things. Yet even those employers actually benefit from you calling it out, because when the services are better, all of us benefit. So it is very tough an environment to operate in. But you said about recommendations.
Recommendation in 1 minute.
Yes, recommendations. We have submitted these recommendations on media. We have submitted recommendations in writing to government. The solutions to the healthcare system is one, political will, such that the right priorities are put in place. And then we fast track implementation. When you want to change or to make internship better, you develop a policy that is inclusive, that is basing on a consultative process. You don't sit in your bed and feel that because you don't have people who are doing medicine, unfortunately, so those who are doing it should suffer. Because when you get sick, you don't go to government hospitals, then those who got them don't suffer. So that is the plan, the political will. And then following the law, following due process to implement things. It's not about anything else. For us as Uganda Medical Association, we are available to respectively dialogue with government, engage government on the best practices that this country and the citizen deserve, not ramshackled policies that have been cooked while people are having sex in their beds. So as I end, I want to ask the judicial officers, the lawyers, we want to see you in an organized manner, ganging up against lawlessness, ganging up against impunity, ganging up against corruption that you have normalized in courts. We want to see the Ministry of Finance prioritize the health care of the voters. Start by paying right the foot soldiers of the healthcare sector, the intern doctors. Then improve the infrastructure. Then we can see how to increase the staffing gaps. We are tired of talking. We want to act. We want to support you actually to put things right. We are not interested in critiquing you. We are interested in making service delivery for the common people better, because anyway, some of us are common people. We are not privileged like you. So give us we have the knowledge, we have the commitment, we have the passion, we have the will. We are here to serve our people. We are not here to quarrel with you. That's the mentality you set up, and that's why you keep hunting us and putting us in the basements. But it will not help. Thank you, Henry.
Thank you so much, Dr. Mirembe. Thank you so much. Dr. Stella, in 30 seconds, wrap up.
In 30 seconds, just to agree with everything that Dr. Mirembe has said, and to say for me, I think in terms of part of the solutions include continuing to call out the political leaders of the Ministry of Health. I think that the push that was made by organizing is important. Continue organizing, Dr. Mirembe, don't get tired. We saw Chris Baryomusi backtracking and saying he's going to call for a review of the policy. He's promised to do this in cabinet, and I think it's as a result of the pressure. But I think part of the other things that need to be done is to make this a people's cause. The division between the doctors and us, the patients or everyday Ugandans, does not help us. It should become our issue as well. In terms of, so the leadership is important. Continue giving us leadership. Yes, they're going to punish you. You become unemployable. Eventually, they take you to basements. But I think that we need to continue organizing the resistance, which challenges them, which calls them out. We may not win today, but eventually they backtrack. Eventually, they make changes. And I think if we are not speaking out and calling them out, then there's nobody checking them, creating balances, and calling them to accountability. So I think given the kind of repression we have, the kind of brutality that's out there, maybe the only thing we can keep doing is to keep talking. So don't get tired of talking. And I think those of us, Henry, who are outside Uganda, all we can do is amplify the issues on the ground. I want to thank you very much for creating the space. Dr. Mirembe, I love you from afar. The love of Christ, a holy love. Keep doing what you're doing. In tomorrow's Uganda, we shall remember you and those with whom you're working to make conditions much better for human dignity for employers who are called medical professionals, including medical interns. Have a good week ahead.
Thank you very much. Have a good week to everyone. So I kept changing positions because I was at home. My wife was a little sick, so for the last 2 days I've been here trying to support her with the children. So I kept changing position because I had to keep running away from the children.
We wish her quick recovery.
Bombi Basawo, they are both doctors. So that's a privileged family right there. But yeah, we thank you.
Okay, thank you very much. Thank you, Henry, for always organizing this.
Yeah,
it's always a pleasure to join.
It is a privilege. It's a privilege. And I want to thank both of you and other people out there who are always interacting with us, listening in, contributing. The people who are following us online, please continue sharing and encouraging other folks, your friends, to come and listen and suggest things that we should be doing. I want to reiterate that today's conversation was never really about just payroll. It was about values, because hospitals exist not because society believes in just payments or making money, but also because it believes that human life has dignity. If that is true, then the dignity of those entrusted with preserving the life, they must also matter. Healthcare system should not just ask its youngest doctors to choose between surviving and serving patients, right? So the question today for Ugandans, I think it's larger than medicine, right? And I think it is a question of nationhood. Will we continue treating healthcare as an expense, or should we begin treating it as an investment in human life? Both in those that are treating, but also those who are practicing the care. Because every doctor who leaves the profession, every exhausted intern who burns out, and every talented graduate who is forced out of this profession, who is forced out of the country, that is brain drain, but that is also a loss of an individual. And it is a loss borne by every patient who will one day need care. So I think we should think about this holistically. How does refusing to pay interns affect our social life? How does it affect our economy as a country? But also, how do we interrogate the concept of compassion and patriotism? So thank you so much for joining us. This is the State of the Nation. My name is Henry Ssali. Always a pleasure to serve you. I love you guys. God bless you. Have a good Sunday evening. Cheers. This is the State of the Nation. Rifa Mwanga. We are deliberate, we are reasonable, we are uncensored. The State of the Nation with Henry Ssali.